Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to our Monday Q&As. This is a place where I answer your specific questions. So if you have a question that is specific to a situation and you would love to get my input on it, you can email it info@drzphd.com. The email is down in description box below. If you're concerned that your question is not something that I'm able to answer, sometimes questions can be too, not something that I'm able, in other words, to generalize, which almost never happens, but usually they tend to be more diagnostic in nature. Then don't worry, I will always email and let you know that that's the case. But like I said, that's rarely happens. Almost always I am able to generalize to everybody else. Having said that, as always, I have selected 6 random questions. I have not had a chance to look over what the questions we have for today. I have, as always, blocked out any identifiable information, such as your email address or your name. So this is completely private. And having said that, there are going to be timestamps below, so feel free to jump around in case if there's something that has of more interest to you based on a description of the coverage. And I think that's pretty much it for housekeeping. Let's get started. I'm really excited. I never know what kind of questions I grab from the folder, other than I always do 6 that come in orders that I received them. And it's always very exciting to me because it puts me in a hot seat. And apparently I love being in a hot seat because I just never know what to expect. This is why sometimes those of you who've been watching these Q&As for a while now, you see sometimes I fumble for answer, I take my time to answer, and I just kind of think it through. So having said that, let's get started. First question for today. Dear Dr. Z, once again, many thanks for your invaluable content, which has helped me so much. You are so welcome. I feel that taking estrogen could probably help me considerably with my feelings of gender dysphoria, but I don't have a desire to grow breasts. Importantly also, I'm afraid of losing my male safe space to return to, in which I can go through society without being gawked at. I feel that I may need the space given that I'm very tall and thus likely will always stand out, and I'm a bit shy. Many years ago, I once took a tiny microdose of estrogen. My nipples popped out immediately and never completely returned. Also, I stopped estrogen right away. My mom has large breasts. Thus, I cannot test drive estrogen for some time without irreversible changes to my body and losing my male safe space. How do I go about making this decision? Right now, I'm thinking of just doing complete social transition and everything else possible to make myself comfortable and hope that it reduces dysphoria sufficiently. And if it does not, then maybe take estrogen after all. This is a great question with one little tiny, and that is, I don't know what gender you identify as. All I know is that you're interested in taking estrogen to help you alleviate gender dysphoria. You are aware that you have gender dysphoria. But remember, people of variety of gender identities can take estrogen, not just trans feminine identified people, but also non-binary femmes, also individuals who are gender fluid, and so on and so forth. So the reason why I'm saying I don't know what your identity is, because sometimes knowing what a person's identity is, it gives me an idea of what your potential goals might be in terms of estrogen, apart from alleviating dysphoria. Now, you bring up some of the concerns is one that you do want to go back and forth, just to, to preserve that safe space with your gender assigned at birth. Which I totally understand, especially given today's time, current what's going on in the world. I can totally, completely get that and understand that. The reason why for so many people, I wouldn't say so many, the reason why for people, when they start taking estrogen, immediately there's a nipple growth, is oftentimes not so much an indication that, oh, that's a sign that you are going to grow large breasts as you continue on estrogen. But that happens for a lot of people because that's initial budding of the nipple areola area. And as a result, it feels like there's a big growth spur For a lot of people, as they know, it immediately feels like that there's a lot of sensation in the chest areas. There's a lot of sensation around nipples. It feels like they're budding out, like little flowers budding out. And then as they continue on estrogen, it's the progression then to grow breasts becomes slower and slower and slower. So I just want to point it out that, and sometimes even if genetically you're having family members that have large breasts, it may and may not work out the same way for you. But I also understand for you, it is a concern. You tried it, it budded out. A lot of times that budding out of the breast can really freak people out because they feel like, oh shit, changes are really happening, especially for people who are non-binary identified or gender fluid, and they're not looking for certain changes. Like for you, you said you're not really looking for, I think you mentioned somewhere here that you're not really looking to grow breasts. I believe you mentioned it. Yes, I don't have a desire to grow breasts. So you take an estrogen then to alleviate dysphoria. Sorry, I went like all around circle with your question. Now I realize that you just told me what your goals are with estrogen apart from alleviating dysphoria. So what do you do in this case, right? You don't want to test drive it because you don't want to have this irreversible change. Should you just go ahead and completely go through social transition? I would say if your desire is not to grow breasts, right? Is there other avenues for you? If when you did take estrogen, it actually helped alleviate dysphoria. One, my question to you would be, is there something else that can help you alleviate dysphoria? So let's start with social transition. If social transition helps you alleviate dysphoria, fantastic. If it doesn't help you alleviate dysphoria, and you remember from when you did take estrogen, it did help you alleviate dysphoria, I would then go back to your medical doctor and say, I took estrogen and it did help alleviate dysphoria, but I experienced breast growth. So what are my options here? I would be also curious to know, are you just taking estrogen, or are you also taking like a testosterone blocker, a long visit, or is it just only estrogen? And if it's only estrogen, in what capacity you're taking it? Are you taking that as, for example, injectable, or are you taking it? What is the route of administration? Or is it oral, or is it patches? Sometimes route of administration can also affect to what extent you can see changes. In the end of the day, unfortunately, if your goal is to reduce dysphoria, and estrogen is what's helping you to reduce dysphoria, and on top of that, you also don't desire to grow breasts at all, it is going to be one of those positions where you kind of have to decide which one matters the most. Because you can't have both, right? You can't take estrogen and not experience any kind of physical changes at all. Some changes are going to be there. Changing route of administration is more about mitigating to what extent the changes are going to take place. Unfortunately, when people are not fully trans-binary and are not after all of those physical changes that the hormones can give them, this becomes one of those gambling dances where you basically sit down and you try to figure out what's going to help you feel better. And sometimes people end up bargaining that, you know what, maybe having slight breast growth, but no dysphoria or very decreased dysphoria is in a long run going to make me feel better and make me feel better and will make my life happier than having no breast development at all and live with dysphoria. So that's something that you're going to have to decide, but sometimes there is a crossroads that you come to, and that's something you're going to have to ask yourself. It is a very tough position to be in. Anybody that wants certain changes on hormones, who wants cherry pick particular things on hormones, in your case, psychological well-being, chances are run into this. The very last resort, I will say this. Perhaps before you even consider going on estrogen in via different route of administration, after talking to your medical doctor, do discuss with your medical doctor, what if you took a naturopathic supplement, some kind of natural form of estrogen. I know that I had a client that did that, and they didn't really have a lot of physical changes at all, but they had psychological changes that helped them. I know it sounds funny, but sometimes people will increase the soy milk intake that they take because it does has higher levels of estrogen. So, you never know until you try what might help you. It may be just what you need to help you with psychological shifts without having those physical changes if you want to avoid physical changes. So, hopefully, that helped. And I wish you all of the best. Like I said, it's a tough position to be in because you're always going to be, unfortunately, in a position where you're going to have to gamble one way or another. Question number 2. Hi, Dr. Z. Oh, okay. So it looks like there's 3 questions within a question. Okay. Wouldn't be the first time. What is your opinion on having? I have had some good results, but did not learn it from therapists. And TL, it has alleviated a few very traumatic incidents regarding my divorce. So as far as I recall, having is a therapeutic technique for specifically for trauma and for anxiety, where they utilize touch and eye movement and distractions, I believe. It kind of makes me think of EMDR, eye movement distillation therapy, which is fantastic as far as I know for trauma therapy. I don't have any opinions on having because trauma is not my central focus. Everybody I work with has trauma one way or another. How can you not? But there's range to severity of trauma, and usually with clients, not usually, the clients I work with have very mild or very mild, I would say, form of trauma where I'm able to utilize my skills and help them. But if somebody has a more severe form of trauma, then I always refer them out to a trauma specialist. So having is not something that's familiar to me at all. I say this, if this seems to be helpful to you, that's great. I'm not sure if that's something you can do. You said you had some good results, but did not learn it from a therapist. So I don't know where you learned it at. I'm not sure if that's, I'm assuming it's something that you can do yourself. I don't know what to say. So again, my philosophy is if something is helping you and it's not actually hurting you, then it's helping you. And I think that's a great thing. Your second question within this question is there any relationship between the number of cases of gender dysphoria when a particular culture or group of people is stressed? To explain, take the war in Ukraine, would female to males incidence of dysphoria be higher stimulated by the need for more men? Oh, okay. So in my experience, this is an interesting question, and this is interesting because during this times of things happening and what's happening around the world, we're asking all this kind of sort of questions. In my experience, um, no, there's no relationship between gender dysphoria and this type of stressors in environment. There's nothing set in environment that is enough in of itself to stimulate gender dysphoria in an individual, as far as I'm concerned. At least gender dysphoria that is stemming from root gender identity issue. It makes me think of sexuality again, not to simplify things, but there's nothing in an environment that can stimulate a person to suddenly become bisexual or become gay or lesbian. You either are or you aren't. Um, sure, there's certain things, for example, women who experience severe trauma in sexual relationship with men may then desire female partners, but oftentimes it's not because that's their sexual preference, but because they simply feel more safer with female partners than with male partners. There's a big difference here. So no, I would say no, that would not stimulate gender dysphoria. What I have observed since being in a practice and since this horrific war in Ukraine, which is just in my, I'm ashamed to sometimes acknowledge that I'm Russian. And since the COVID as well, what I have noticed as a clinician is that when there are cultural stressors in the world, COVID, war somewhere, natural disasters, hurricanes, financial crisis, it tends to increase dysphoria that's already is there. Any additional stress in your ecosystem, which is your world, will push on any internal stress a person already experiences. And in your cases, it is going to be dysphoria. and it is going to increase that stress. In addition to that, any crisis in ecosystem, depending on a crisis, will a lot of times bring up existential crisis. This is why during COVID, so many people came out, because people were confronted, even on an unconscious level, with their mortality. So we're confronted with realities that death might happen because we were witnessing death, and people were confronted to confront their own death. When you confront your mortality on such level, you start confronting things within yourself you've been avoiding. And for a lot of people, it was gender dysphoria. So there was a floodgates of people coming out. So I would say that. But that's, again, to be super clear, stressors in ecosystem do not make a person trans. What they do is, if you are already trans and experiencing gender dysphoria, it will increase the gender dysphoria. It will increase the stress in association to the gender dysphoria. It's a really good question. And your final question from this trio, I would really love to know where you get your glasses. I've searched the internet to no avail, but would purchase a pair. I just broke mine recently. Oh, thank you in advance for all you do. Another great question, and the one that I can totally answer. It sucks to break your glasses. I have really bad stigmatism. So I have to wear glasses. I wear glasses all of the time. I probably only don't wear glasses when I work out. The pairs that all of you usually see me in, the really large, even bigger than this black one, my Edna mode glasses, those are Tom Fords. And they're Tom Ford's sunglasses, actually, because I usually go for bigger, and they make them bigger in sunglasses. So I bought them as sunglasses, but converted them to eyeglasses. So they're Tom Ford. I had other pair of square ones that broke recently. They were Cillian. I got to the point of my life where I am kind of becoming a savvy consumer, and I'm realizing I'm wearing plastic on my face that is the same plastic as anywhere else. And there's no need to pay, I don't know, $400 for a pair of glasses. On top of that, another high-end price to put lenses in. So let's just say I'm becoming a little bit savior with the plastics that I put on my face. So now the glasses you see, and probably a lot of other interesting glasses you'll see in other of my videos, are coming from, there's a company I found, it's called Wooglam, Wooglam, and it's in China, and it's ridiculously cheap frames, and they will do prescription lenses for ridiculous price. So this time I thought, before my Tom Fords, my favorite Tom Fords, are going to break, I'm just going to buy a whole bunch of cheap pairs. And as you can see, you know, it's all about how you wear it. You can wear either expensive frames or cheap, but it's all about how you wear it, as it makes all the difference. So that is where this pair is from. And I realized they're so circular, more circular, perfect circle than my Tom Ford. That now I went from looking like Edna to looking like Despicable Me, which I love it. I'm waiting, just waiting for somebody to notice the similarity and to start pointing that out, because people love pointing those things out. So yeah, Wooglam, get you glasses on Wooglam, super cheap. You just have to virtually try them on and gamble on it. But yeah, so great set of questions. Question number 3. I have come out as non-binary and I'm wanting to transition from male to female, but I don't feel like a man or a woman. And when I look at myself as a man, it bothers me. And when I look at myself as a woman, it irritates me, bothers me, and I don't feel like any gender. And also, I'm disgusted by my penis and by being in a male body. And by being in a male body, would that make me non-binary? And when I think of myself as a man being with a woman, it disgusts me. When I think of myself as a woman being with a man, it does not disgust me. It attracts me. It turns me on. I feel like I just read a riddle. And perhaps this is a riddle to you too. Gender sometimes for some of us feels like a riddle we cannot solve. So you came out as non-binary and you're very clear that you want to transition from male to female, but yet you don't feel like a man or a woman. You pointed out numerous examples that you don't feel like a man or a woman, which is very clear distinction for anybody who identifies as non-binary. Remember, non-binary identity is not exclusively one or another. So, but yet at the same time, you have discomfort when you're looking at your body parts, when you think of yourself as a woman, also, it irritates you. The only time when it doesn't irritate you is when you are thinking of yourself as a woman being with women. So only sexually, when you're thinking about yourself in a sexual position, an intimate position, it doesn't irritate you, it turns you on, it excites you. So I would encourage for you to definitely explore more. Does this necessarily makes you non-binary? Maybe. Is it possible that you're actually trans female and having a lot of resistance to owning up and own that identity because there's maybe fear? A lot of times I see people have a lot of resistance to owning trans-binary identity because they realize everything they have to do in order to get to that identity. And that overwhelms them. And as a result, it creates a lot of resistance for individuals. So this could be a case here. Hard to say. I would say explore more. You also need to explore your sexuality. What is it about picturing yourself as a woman with women that is appealing to you? What is attractive to you about it? What if you had a more, what if you had maybe a more non-binary presentation? Can you imagine yourself in that way sexually? How does that make you feel? What kind of feelings does that bring up? So definitely this is a question that warrants more exploration. There's just not enough there. And I think you yourself don't know yet. This is why it feels like a riddle when I read it. Perhaps it feels like a riddle to you too. But explore for sure. Um, and could it possibly be that you're actually trans-binary, but again, you're pushing against that identity because you're realizing everything that entails in gender transition? A lot of times also people have a lot of resistance to a binary identity because they have a feeling or they have a thought that they're not going to pass. If passing is goal for some people, sometimes people already have started telling themselves messages, micromanages that I'm not going to pass, I'm too tall, I'm too whatever, my voice, whatever it is people tell themselves. And so as a result, it creates resistance. And then they start dancing around this identity and start selling themselves on the ideas that, oh, well, maybe I'm non-binary then. So lots to explore here. Hopefully you're working with a therapist. If not, I would encourage for you to find a local one and explore resistance and also explore your sexual preferences a little bit more. Question number 4. Hi, Dr. Z. I have been questioning my gender for the past few years. At the beginning of 2023, I decided I should give social transition a try in an attempt to get a better idea of what makes me feel good and comfortable in regards to gender and what doesn't. I've since asked my long-term partner and my close friends to use they, them pronouns for me, and they have all been very supportive. I've also been dressing more masculine and binding my chest. I'm assigned female at birth. All of these changes have felt good, and I'm beginning to identify more and more with the label of non-binary. That being said, when people ask me what my gender is, in a kind of curious, in a kind and curious way, I usually just respond with something along the lines of, I'm not really sure, I'm just myself. I want to come out to my family and have them use more gender neutral language for me, but I'm scared to bring this up because they are relatively conservative and I don't think they would be receptive. I'm also hesitant to come out to them because I still feel like I'm in the questioning/exploratory stage of my gender journey. As of right now, non-binary feels like the correct label. But what if somewhere down the line I do more soul searching and I realize that I'm just gender non-conforming woman? I feel like once I come out to my parents as non-binary, I want to be able to take it back. I value my relationship with my parents, but it is getting harder and harder for me to constantly hear them use she, her for me and be referred to as their daughter when we call. I'm financially independent and I live a few states away from my parents, so I wouldn't be put in danger if they responded poorly. However, I would be crushed if they rejected me. Thank you so much for reading through all of this, and any advice or tips on how I should proceed would be greatly appreciated. This is a really good question because so many people in your position have the same conflict. conflict of not really fully feeling like they identify with their gender assigned at birth, citing some social aspects in their transition, but still feel like their questionings are maybe not fully locked in 100%. Well, nobody's going to have 100%, but really locked in to some element of certainty. And as a result, also don't really want to come out to their family, especially their parents, because they don't want them to, for all of the reasons you mentioned and more. So, and sometimes people feel like they don't want to come out to their parents because there's the fears that if your identity changes and you revert back to she, her pronouns, your parents are going to say, well, how can I take this seriously? How can you not know? So it can be tough because parents sometimes don't really fully understand how part of a route to a full understanding who you are as an individual in regard to gender is actually trying the things out. This is why social transition is so crucial, because there's nothing in it that is irreversible. Everything in social transition is fully malleable and can change any minute. A few things for you. So even though you have been binding and dressing more masculine and you came out to your friends and your friends have been very supportive and it feels good with the pronouns they use, I have a feeling that you still not really fully on a solid footing with how you see yourself, because even when people ask you for your pronouns, you say, I'm not really sure, I'm just myself. So it feels like even you are hesitant to lock yourself into a particular identity. I think that at this point of your gender journey, if you're still not sure on a solid footing, I would encourage for you not to be afraid to lock yourself into non-binary identity or any other gender identity and socially explore it even deeper. I would be hesitant to encourage you to go on medical treatment such as hormones or especially surgery at this point without you feeling more locked into your identity. But there's nothing wrong. And sometimes, sometimes psychologically, if we need to get locked into something to really then feel like, to really get the feel for it. Something happens to us when we tell people, when people ask us what our gender is, and we say, I don't know, I'm not sure, I'm just myself, I'm still exploring, versus I'm non-binary. Something happens when we vocalize who we are. Even if you're exploring, that vocalization, that ownership, level of ownership, will also help you know on a deeper level if that feels right, right? It's also going to give you a little bit of intel. If, oh, this, wow, when I say it like that, it feels right. Or it may be the opposite, that, oh, wow, I thought I was non-binary, but when I say it to people who don't know me, to strangers, not my friends, but to strangers, it doesn't feel right. Something about it doesn't feel right. So I would encourage for you to go ahead and try, like literally try on different gender identities, and as you socially explore them and see what happens. When it comes to parents, that's up for you to decide. Here's how I see this, okay? I see, and I'm assuming you're adult, I see it this way. Sounds like you are exploring. At some point, you're going to come to a place of knowing, a place of this deeper knowing where you will know who you are. Sounds like at that point, regardless, you're going to have to then share with your parents, right? So the reaction is still going to happen no matter what. By not doing it now, you're just basically buying yourself time, and you basically kind of preventing yourself from experiencing what their reaction might be. You're assuming they may have a negative reaction, but you really don't know. They may have a very supportive reaction. Maybe they'll have even more supportive reaction if you express to them that you're doing this because you're still exploring, and you're doing this because it's better to explore this way than jump into something that is going to be irreversible. I think in the list, they will respect that, the prudency in your decision making. So it's really up for you to decide. I think there is a benefit, might be a benefit to come out to parents now and share with them that you're still trying to figure out where you land before you make any other big decisions, because it sounds like you're going to have to do that no matter what. But I also understand, what if your identity is gender nonconforming female, and then you're returning back to gender assigned at birth with a non-conforming element to it? That could happen too. Again, you won't know until you explore. Lots of the things for a lot of you who are watching this, who are in similar situation, are unknown until exploration takes place. This is why social is so, so important. So think about it, but I would still at least encourage you at least to lock in the non-binary identity and socially explore among your friends and among people who don't know you, just to see what that feels like, just to see what it brings to the table for you. And maybe just doing that will make you more solid in who you are, and then will lend itself to coming out to your parents. So I wish you all of the best. That's a really good question. Question number 5. Subject: feeling flat. Message: hi, Dr. Z. As usual, I want to say how amazing you are and are of great help to many people. You are so, so welcome, everybody. I if I die today, I'd be such a happy woman, because I feel like this channel is really feels a lot of times like my legacy. I'm a 49-year-old trans woman trying to live as best I can. For financial and family reasons, I need to continue living between two worlds, male and female. This is so, so common. It breaks my heart when I read this every time, because so many of you have to be in that position. I've been on hormones approximately 18 months, and also I feel better in some ways. In others, I am the same. At the moment, I'm having feeling that I should stop hormones and accept how I was born. Both my wife and myself are scared of this, so as we don't know if I could spiral into dark place. I know I'm transgender. I just feel I will never be accepted or pass, even though I have no evidence that I don't when presenting femme. Even so, I wonder if it is worth the effort. If I'm never going to be happy, then why bother? I'm hoping this is me transition blues, so to speak, and I know living between two worlds isn't healthy. However, I can't see a direct path to happiness. I would love to hear your thoughts on my situation. My heart goes out to you first and foremost. That is a very, very difficult situation to be in. I have so many questions for you. When you say, I wonder if it's worth the effort, if I'm never going to be happy, why bother? So 18 months on hormones. You said that sometimes you feel better in some ways, in others, you're the same, right? First of all, the fact that sometimes you feel better is already a projection and a progress in a toward positive sign, versus not feeling happy at all. Second of all, it's going to be really, really difficult to fully feel happier and better when your desire is to transition, when you identify as a woman, and you're unable to do that, and you have to present as your gender assigned at birth. It sounds like, I would assume, at work. So maybe even people around you, maybe it's only you and your wife, who knows. So imagine the scenario. Even if you're on hormones, remember, hormones are not a magic pill. They are meant to be there in combination with a lot of other things. One of them is coming out and socially transitioning, and then medically transitioning for those who want to. So imagine the scenario: you're taking hormones and they're starting to help a little bit, but it is very hard when you go out there and people gender you as men, when you have female hormones raging through your body, when your brain is wired as a female brain. It's almost like taking hormones at this point and living a double life as you gender assigned at birth. It's as if you're putting yourself in a position of even more feeling of dysphoria, because you're giving your body essential nutrients. You're giving your body essential hormone, which should have been there naturally from the get-go, which belongs to you. but the externally, you're not giving yourself that external opportunity. And so externally, you're putting yourself in position to be misgendered constantly when internally there's a woman that is just dying to come out. And that type of combination is what probably creating the feeling of flat and making you feel like nothing is working. Because I think deep down inside, what you really, really want is to transition. Here's the thing. Some people deep down inside, all they want is to do very bare minimum because they want to preserve the status quo. That psychologically will create a different type of internal schema. And from that internal schema, there's going to be different psychological distress. If a person on the inside really wants to transition, but is not able to, but takes hormones, but they're not able to do everything else, that's also going to scream a different level of distress. I hope that's kind of clear. You also, you're afraid you won't pass, but you have no evidence of that whatsoever. I would be curious to know what's holding you back. For financial and family reasons, I need to continue. So for financial and family reasons, somebody else in the family doesn't know. And financially, because you're afraid you're going to lose your job, maybe, or maybe you're afraid you won't afford the surgeries. What I will say is this, and this is going to be really hard to hear for a lot of people, but this is what I have seen. I have had a client who was homeless. She was homeless, living on the streets here in Los Angeles, completely homeless. Not only she was homeless, but she was also struggling with very severe secondary diagnosis. And I'm talking about really, really severe. And she managed to transition. Did she get the best world-renowned surgeon? Nope. She didn't. Was she able to get hormones and a surgery? Yeah. Yeah. She had breast augmentation. She was scheduled to have FFS. Yeah. I have also seen, and I had a client that was living on disability benefits, no extra money for anything at all, and they were able to transition. Things are possible financial. Are they absolutely more challenging? 1,000%. 1,000%. Are they also different in terms of what you can get? 1,000%. But are they possible? Yes. And the reason why they're possible is because there are a lot of at least I'm talking about here in the United States, there's a lot of places, medical here will cover all of the surgeries, for example. So there are possibilities out there. So I say this with all the respect for anybody in financial position, but I just want, things to happen and people make it happen. It is definitely harder for sure. I don't have a feeling that for you, it would work out accepting how you were born. I say this with all respect. And I say that because as a provider in this field that worked with thousands of people, I have never seen somebody who was able to accept their gender assigned at birth. What people do accept, they accept that they have decided not to do anything about it. But that acceptance, to some extent, may help a little bit, but the dysphoria is still there. So I wish you all of the best. I do think that if you are already scared, stopping hormone, that it's going to spiral you into the dark. It sounds like you already know that you've been in the dark place before, and so does your wife, and both of you are scared that might happen to you. I would say that is concern. In the very least, it sounds like the hormones are keeping you outside of being in the dark. In the very least, that is already a progress than no progress at all. So think about your health, think about yourself. Sometimes we feel like we're back against wall and we really feel like there's no way out. no way out. And we start telling ourselves that there's no way I can do this. But there's always something. There's always some kind of a way. And others who are watching this will comment who had been in position where they really felt like their backs were against the wall. And a lot of times it can genuinely feel like there's no way out. And yet there was one. Sometimes we just don't see it because our mind gets locked into thinking that way. So I wish you all of the best, and my heart really goes out to you. Final question for today, question number 6. Hello, Dr. Z. I have a question about voice. I am male to femme envy, and I've been trying to train my voice to sound more femme. I followed endless numbers of YouTube videos about the topic and tried voice training, but no matter what I do, my voice still sounds like male me. The problem I find worst is when I'm tired or stressed, which is a lot of the time, my voice drops almost an entire octave, and I really dislike this. Is vocal surgery my best/only option? Thank you in advance. Really, really good question. So I have few suggestions for you. One, if you are doing voice training only by using a lot of free resources, such as there's voice lessons on YouTube and things like that, which is great resource. But if you're doing things by yourself, you may just unfortunately do things incorrectly and not get any results. Voice therapy is costly for sure. It still might go miles and miles away to at least find a voice therapist that you can at least pay to show everything you've been doing so that they can course correct you. So that's the first thing that comes to mind to me. Number 2, voice training takes time. It takes time. I have never yet seen a person that were not able to change their voice solely from voice therapy alone. Have never seen. Everybody has always been able to change their voice. Now, having said that, was their voice to the level they wanted it? Was the voice completely how they desired it? No, not always. But the changes are made with voice therapy. This is why we as providers always recommend voice therapy first, because people do it all the time. Voice therapy is one of those things that you have to practice to reap any kind of rewards. And oftentimes we think we do practice, but we don't do enough to reap the rewards. The vocal box is a muscle. And actually, believe it or not, the way we all sound is not the way we were born to sound. This depends on a lot of things, the way people talk to us back, based also the way on our gender, but it's the way people at least gendered us as babies and the way they, talk to us in a softer voice. But this is a vocal box and it's a muscle, and anybody can masculinize or feminize their voice with enough training. So that takes a lot of dedication. Anybody who were successful at voice modification knows how much work. And a lot of people don't like to put in work because it's so uncomfortable. It's so uncomfortable to hear yourself. None of us like to hear how we sound, especially if you already don't like how you sound from the outset. It brings up dysphoria, discomfort. You feel like you sound silly when you practice, when you do exercise, you feel ridiculous. Enough factors for people to slack off on practicing. So, having said that, I would still recommend to reevaluate if you're really being diligent with voice training. The reason why your voice drops when you are stressed, which happens even to trans women who have, or femme, non-binary folks who have already mastered their voice to the feminine range. The reason why for almost everybody, the voice will drop back, revert back to habituated masculine way of expressing yourself during stress, during fearful situations, a lot of times during sexual orgasm too. It's because that's, first of all, your brain in those situations is habituated. In a stressful situation, your brain is habituated to become kind of like alpha energy. Even my voice will change when I'm in a stressful situation, right? When any of us argue, our voice will rise up and change. So the same thing happens. It's just habituating pattern that you have to work on. Same thing with fearful, scary situation. Orgasm, it just so happens to be so unconscious that it's almost like your brain just goes into this in a way it used to vocalize it. So that's why it happens for a lot of people. Is vocal surgery your best option? I don't know. Vocal surgery is very tricky. It's either a hit or a miss. It doesn't fix everything. And I have seen where people would have a side effect where every time they would swallow, their skin right here would look like it's pinched. And on top of that, people would feel that they're constantly dehydrated and they have to swallow again and again and again. That's one of the unfortunately not side effects, but one of the risks, one of the negatives that happens to sometimes rarely to individuals having vocal surgery. I had clients who had vocal surgery who had zero results. They had it with really good providers. They sound exactly the same going into the surgery. Who knows? And I had those who had vocal surgery and they sound more feminine, much better. So vocal surgery is a big gamble that you're going to have to be willing to take. I always recommend before restoring to vocal surgery to try maximizing voice training. If you're in United States and you want a really good vocal voice therapist who works with all of my clients, she's phenomenal. A lot of you have seen her in my Dr. Z interviews, Erin G. Lettuce. She gets everybody to their voice faster than anybody else I've seen. She's very reasonable and she's perfect if somebody just wants to pay her to consult her. Am I doing this right? Can I modify? What am I doing wrong? So I love her for that. So if anybody needs that contact, feel free to email me. But yeah, voice is one of those things. I would say still reevaluate how you're training. Are you really training? Sometimes we think we're training, but we're kind of not, because it's, again, like I said, it is so uncomfortable to do. Great question. Great questions for today. Thank you, everybody who sent me your questions. Thank you, everybody who continues to send you questions. Don't ever hesitate to feel that your question is already been answered. A lot of times the way you will phrase your particular question is the ways that somebody else has never thought about. I had a lot of people write to me and say that they never thought about an issue until they heard somebody else vocalize it. So by asking questions and getting answers, you're also really helping everybody else, because chances are if you're thinking some of the things, everybody else is thinking some of the things too. So having said that, comment below, let me know what your thoughts are. Everybody have a wonderful day, and I'll see you all next time. Bye.